Welcome to the MD Edge Daily News for Tuesday, August 14th. I'm Nick Andrews.
And I'm Terry Rudd. Today, OnDemand Prep may match daily prep for HIV prevention.
Also today, contraceptive implants and IUDs deliver similar continuation and complication rates.
And later, the feds want accountable care organizations to take on more risk.
But we begin today with a reproductive first. The FDA has approved a mobile app for contraceptive use. The app is called Natural Cycles. It calculates the days of the month that women are likely to be fertile. The calculation's based on an algorithm that uses data such as daily body temperature readings and menstrual cycle information. Natural Cycles is intended for premenopausal women aged 18 years and older. App users take their daily body temperature and enter the information in the app. The more sensitive basal body thermometer can detect temperature elevations during ovulation. That allows the app to display a warning on days when users are the most fertile. During those days, women should either abstain from sex or use protection. Dr. Terry Cornelison is an assistant director for the health of women in the FDA's Center for Devices and Radiological Health. Dr. Cornelison says consumers are increasingly using digital health technologies to inform their everyday health decisions. She also says this new app can provide an effective method of contraception if it's used carefully and correctly. Natural Cycles is available for free on the Apple App Store and Google Play for Android. Click the link in the podcast description to see clinical data on how the Natural Cycles app compares to condoms and oral contraceptives.
On-demand pre-exposure prophylaxis may be as effective as daily PrEP for preventing the spread of HIV. That's according to a prospective real-world study of more than 1,100 French men who have sex with men. The researchers compared efficacy and adherence rates of on-demand PrEP to those of daily PrEP. Study participants could choose either on-demand PrEP or a daily regimen. 96% of men who opted for the on-demand regimen used it correctly. That meant they took at least one pill within 24 hours of sex and at least one pill within 24 hours after sex. During follow-up, the researchers identified no one who became HIV infected. Dr. Jean-Michel Molina is a professor of infectious diseases at the University of Paris. He called the level of protection provided by on-demand PrEP remarkable. The researchers caution, however, that the study focused on men who have sex with men. That means on-demand PrEP's efficacy isn't proven for preventing HIV infection during heterosexual sex.
Two types of long-acting reversible contraception delivered high levels of continuation and low levels of complications in a study of Medicaid-covered women. That means increasing adolescent access to these contraceptives is likely to be cost-effective, according to the study's authors. Researchers examined medical claims from more than 3,000 women who lived in Maryland and the District of Columbia. The women were between 15 and 44 years old when they underwent contraceptive treatment. More than 1,300 women had subdermal etnogestrel implants inserted, while nearly 2,000 had IUDs inserted. Claims for complications were similar between the groups, even after controlling for various factors. Dysfunctional uterine bleeding was the most common complication, followed by excessive or frequent menstruation. Few women reported pregnancy among the implant and IUD groups, and there was no statistically significant difference in pregnancy between the groups. The authors note that the study didn't control for factors like socioeconomic status, psychological conditions, and multimorbidity.
The Centers for Medicare and Medicaid Services says that accountable care organizations are playing it too safe. Now CMS wants to change the rules and push more ACOs to take more financial risk with some added flexibility. CMS Administrator Seema Verma says ACOs were designed to move Medicare away from fee-for-service. ACOs encourage providers to find innovative ways to deliver high-quality care, cut costs, and focus on health outcomes over process. Ms. Verma says that's not what's happening now. Under the current program, physicians can participate for up to 6 years in an ACO that takes on upside risk only. After that, they have to take on downside risk, returning payments to the government if the ACO fails to hit spending targets. But after 6 years, Ms. Verma says, more than 82% of shared savings program ACOs are in an upside risk-only track. She adds that upside risk-only ACOs generally are spending more money and aren't generating the savings that ACOs in a two-sided risk arrangement are. To end that trend, CMS wants to give ACOs only 2 years in an upside risk-only arrangement, after which they'd move to a two-sided risk arrangement. To sweeten the pot, CMS would let risk-taking ACOs give patients incentive payments, pay ACOs for telehealth services, and streamline some quality measures. CMS will take comments on its plan till October 16th at regulations.gov. And that concludes the Tuesday edition of the MD Edge Daily News. You can find links to these stories in the podcast description. For MD Edge, I'm Terry Rudd.
And I'm Nick Andrews. The Daily News is published bright and early every morning, so you can listen to the day's top medical news however you start your day.